Barbell deadlifts, barbell squats, overhead press, lat pull down, chest press. And when you're ready to stop, repeat. That's how we climb Olympia. When you push that extra rep, when you pull another set, when you lift that one last rep, you will climb the mountain and no one will forget. Bring on the build with the NASM Physique and Bodybuilding Coach Program.
You're listening to Random Fit with hosts Wendy Batts and Ken Miller, winner of a Gold Markham Award for Digital Media.
Hello, everyone. Welcome to this week's episode of Random Fit. I am Wendy Batts here with my co-host and friend, Mr. Ken Miller. Ken, how are you today?
Awesome, Wendy. How you doing? You looking good?
Oh, why, thanks. You know, what better way to start my day than that, right? Well, today I'm really excited. I know I say this every single weekend or week. I shouldn't even say weekend. I'm just looking forward to what's ahead, I guess. But this week we have a very special guest. He's really a friend, but definitely a colleague and someone that I admire a lot in our industry. Dr. Scott Cheatham will be joining us today talking about fitness and COVID. When we had Dr. Cheatham on our Optima sessions, he did a great presentation regarding COVID, and we got a lot of really positive feedback. And so we wanted to invite him to the show so we could kind of dive a little bit deeper. And those of you guys that don't know Dr. Scott, Scott is a board certified orthopedic physical therapist. He is a professor and associate chair for the Department of Kinesiology at California State University, Dominguez Hills. He owns his own business, Sports Medicine Alliance. And then, of course, he's on our NASM advisory board. So I want to go ahead and bring him in. Ken, let's bring Dr. Scott in this morning.
Let's see the guy. All right.
The man of the hour.
Thank you, Wendy and Ken. I appreciate being here and being able to talk with you guys. My first time on the podcast here. And thank you for the NASM family for listening. So I appreciate it.
Yes. Such a good topic today, Scott. So, I know Ken and we have a bunch of questions to ask you. And Ken, do you want to start us off or do you want me to?
Yeah. As my training facility gets busier and busier. So as the months have gone by since late last year, people have gotten more confidence in coming back. Trainers are training more often. But we are getting that clientele that is coming in that, was afraid of being amongst other people in working post-COVID, so the confidence as far as being, familiar with COVID and what it's done to them for the last, 2 years, putting on the COVID-15 as they call it versus the COVID-19. Right. But can you explain to us just to start off with some fundamental information, what is COVID and what is it doing to the body? I mean, if you can summarize that within the length of the podcast, but as people come in, they come in with different interpretations of what the information is about what it is that they went through.
Yeah. So, that's a great question. Let me try to decipher it. Okay. So COVID-19 is actually the clinical signs and symptoms of the SARS-CoV-2 virus. So we know that SARS came out several years ago, but it was contained. And so that was SARS-1. Well, the next version of it, or the next mutation, came out called SARS-CoV-2. And so when the research experts around the world started to see this SARS-CoV-2 manifest and spread, it was really kind of named and officially discovered by the World Health Organization and CDC from the United States and other medical experts in 2019. And so that's when they named it COVID-19. So COVID is just really a short name for 2019, but that really represents the signs and symptoms that is manifested when the virus is in a human. So that's where it has it. Now, what's interesting is when we look at the pandemic history, we've had basically 5 pandemics to the human race ever since 1918, the Spanish flu. And all the other 4 pandemics were from the influenza A virus. And I think that that's an important point, because that's what's led to our annual boosters, right, of the influenza shot. So around September, October, when we start seeing all the commercials saying, hey, you need to get your flu shot this year, that was really a product of the 4 pandemics that were the influenza. So the SARS-CoV-2 was a new kind of RNA-based virus, which we know that RNA is a messenger between DNA and protein synthesis. And so it was new to the human race. And that's why it kind of spread into a pandemic, because obviously these viruses need a host or a human. And so we started to see all these variants or these mutations spread across the world. And so as the virus was jumping from continent to continent, that's when we were getting all these different variations. And so over the last 2+ years, we've been kind of fighting it with the vaccines and also the herd immunity and coming up with therapeutics on how to treat it. So that's kind of, and so as we kind of fast forward till today, this is where COVID-19, it seems like it's weakened because the mutations have finally weakened, because where a lot of the experts are thinking that there's so much herd immunity throughout the world that the virus, the virus structure is starting to break down. And so it's starting to weaken. So we're starting to see, especially with this Omicron, that it is more of a weaker virus, and it's manifesting itself and presenting itself almost like a weaker flu. Okay, so that's kind of the latest. Hopefully, Ken, that answered your.
No, you did. You definitely did, because the next question on that is, as we talked to Dr. Scott here on Random Fit with both Wendy Batts and I, Ken Miller, we are exploring the component of fitness that we just can't get away from, which is now COVID-19 and working out in the post-COVID pandemic. But thanks for that clarification, Dr. Scott, on what COVID-19 is. And, because I've got clients that, especially last year or when it was first coming through, they'll have that symptom of tasting things just not the same. Like I've had friends that lost taste, and and that's not something that just lasted 10 days. It's something that I've got a buddy who it lasted for 6 months, where you could taste, but things didn't taste the same. Almost his symptom was that things tasted tinny, if I can find a word for it. But what I want to know right now is, when it comes to, as you said, the symptoms actually, getting less and less and less as time comes by. But what about those that had symptoms that lasted longer than a couple weeks?
Mm-hmm. Yeah. So believe it or not, in the early 2020, they were the COVID-19 literature and the experts were calling it the long haulers, right? So, but they changed the name, because I think now that as a society, we're getting a little bit more politically correct. We don't want to label somebody as a long hauler. So the new term is individuals with long COVID. And so there's a small cohort of individuals who do get COVID-19. They recover, but then they have this lingering cluster of symptoms and signs, right? Side effects or issues or complications that last, at least in my experience, up to about 3 months or even more. When we look at the COVID-19 literature, study after study, as they've progressed from 2019 to 2020, even up until this month, talk about that there's more than 50 or more long-term complications with it. But it's important to understand is that if you have a client who got ventilated and they're in the hospital, they're going to have longer term, possibly permanent complications because somehow they might have been in that at-risk group, and COVID-19 has really done a number on their body. So currently we start seeing that people have these cluster of kind of random symptoms, and the new term would be individuals with long COVID.
So with you kind of piggybacking off of that, Scott, can you kind of go into a little more information? Like what are the primary long-term effects of somebody when you're talking about, you've had COVID or these that were affected more so than others? Can you kind of talk us a little bit, like talk through that?
Yeah, I think it's important to realize that there's a primary cluster of general symptoms, such as someone who had COVID. They're tired and they're fatigued. Another thing they call it is post-exertional malaise, where they'll do some activities of daily living. Maybe they'll even go to Costco and try to, fight through the crowds at Costco, and they get exhausted from that, or they try to exercise. The fever's still present. And also too, there's a new manifestation that has been showing up more and more, and that is cognitive problems that these individuals are getting. And a lot of the literature is starting to call it almost like the COVID fog, where they're having difficulty focusing, sleeping. They might have what's called photophobia, which is sensitivity to light. And so we're starting to see these manifestations of that. And then from there, there's a subclass of people who are more active, where they're starting to still have the respiratory, which is the original, obviously, SARS, but also they're getting, there's some possible heart inflammatory issues, myocarditis and stuff that is starting to show up with some active individuals, and we can talk about that later. So we have our primary cluster, which is really identified by the COVID fog, and then we have a lot of secondary symptoms. And I think it's important, at least I always have to remember, is that COVID-19 is a systemic virus. And originally we thought it was just focused on the respiratory tract, but we're starting to see more and more that it affects people differently, but it seems to have a widespread effect on all the major physiological systems of the body. So it's interesting how it's really transpired and how we learn more and more from it. Because I've had patients that have the simple COVID fog. I've had patients that have had rashes. They've had some really weird manifestations from it. And it's interesting to see how it kind of goes from there.
That's very interesting. Okay, sorry, Wendy, but you've got to practice. You work with athletes, Scott, and so how do you figure out? Do you have a screening process to figure, because it is systemic, if someone's experiencing a cognitive issue, or if it's a respiratory issue? How do you figure out? Because I'm sure your protocol then, if I could say that, would be different if it was somebody that was feeling that more of the cognitive experience versus somebody that's feeling that malaise or that level of fatigue when it comes to movement.
Yeah. So first and foremost, I make sure I stay within my scope of practice. I think that's a huge point. And then I'm usually working at the time with a medical doctor that they've seen. So I'll collaborate with the medical professional on what they're seeing. And then from there, we're dealing with their long-term consequences, let's say, or complications. So if it's a respiratory, typically I'm dealing with some type of respiratory specialist where, they may control the individual by using an RPE. I've had medical doctors tell me about the RPE, or even using a heart rate throughout the time to kind of go from there. If it's, I've had 2 athletes in my practice that have had the heart muscle inflammation. That is a completely different protocol. They're actually off for a couple months because it's such a dangerous manifestation and complication. So I'm usually working with a medical professional, and then from there, I will scaffold my questions and my monitoring based on what they're doing. So for example, if someone has the cognitive issues like the fog, obviously staying evidence-based is huge because the research is constantly being produced with this, but I'm usually working with the primary doctor, and we're actually using more concussion protocols. We're actually treating them. And what's interesting, especially with like with this fog that they're having, is that probably, because I've seen about 20 plus patients this last year who have had long COVID symptoms. If they do cardiovascular exercise, they feel like that their fogginess clears up. So it's an interesting thing. So we're still learning as we go, but I'm making sure that I work with a medical professional, right? Someone who's, I go to the next pay grade, and I just make sure that it's there, but also too, based on what their symptoms are having, we're still monitoring. Some of the basic screenings that we're doing is I obviously have my COVID screen, but along the way, I'm using, I'm using the pulse oximeter. Everyone remembers these, right? So I'll kind of bring that out right here where we get it on the finger. So we're monitoring their oxygen level and their heart rate all the way through. And I find that that's a good way to, as we try to exercise them and stuff. And I'm sure we'll get into that here in a little bit.
Interesting. So Scott, I actually have 2 questions. So I'm going to kind of piggyback on what you just said, but then I also have something that's completely different based on like my scope of practice for sure. But the first question is based on, the medical, when you're talking to these other professionals that are dealing with this, do they ever see that fog like fading and not just doing cardio where it gets better, but then it obviously is coming back? I mean, do they see that this is something that will eventually go away, or do they think it's going to be here to stay? And then the second part of that question would be, as a fitness professional, is there something specific that if I know someone has had COVID and they've had some of these effects, meaning the brain fog, or that they had some issues with their heart and the respiratory system, are there certain things that I should really consider before they actually start exercising with me? I mean, without saying the medical clearance, because we know that, but once they get cleared to exercise, as a fitness professional, staying within my scope, what would you recommend me making sure I do before, and then definitely during, if I don't have access to a pulsometer or something along those lines?
Okay. All right. So your first question, we'll address that, is that we're still learning a lot about the virus. So, but I'm seeing, at least with my patients, the complications tend to dissipate at about 3 months post infection. So we're looking at 3 months from the full recovery. You know how they say it's 10 days. So they're actually testing negative, and then we're seeing this kind of like this approximate 3-month fade from there. Now, as far as the scope of practice, I do agree that the fitness professional needs to be well aware of safety for these individuals, because again, we're still learning about it, and in my humble opinion, it's a systemic issue. It affects people differently. So a lot of the key things that's been cited in the research evidence, as well as with professionals, is the biggest tool would be using the OPT model and really slowly progressing them through, beginning with phase 1 all the way through the OPT. That to me, that's the first thing that should be considered with the fitness professional. The second thing is using the RPE scale concurrently through their exercise program, so that if you are taking them through, let's say they're in phase 2 and you are taking them through some supersets, you should be checking with them concurrently on their RPE number. And a lot of times when I work with my clients, I'll obviously review with them the first session what the RPE scale is. I use 0 to 10, so it's much easier. And then I may simply say, like if I was working out with Ken, okay, Ken, even in the middle of the exercise, 0 to 10, how are you doing? If you start seeing them fatigued or whatever. So I think concurrently using the RPE, and then also too, believe it or not, these pulse oximeters, they're pretty accurate. And you can get them on Amazon for pretty cheap. I think like $9 or $10. They're very accessible. And the reason I like this is that if the fitness professional establishes, their clients, max heart rate, and they can use whatever the Carbonin or whatever formula they want to establish their zones, they obviously should begin in zone 1 and then progress all the way through. But with the pulse oximeter, you can concurrently monitor them and also to see if there's any spikes in their heart rate and kind of correlate that as what the client is feeling. So I like to use the RPE with these little devices, or even a subjective. And then also too, I'm always observing the respirations, right? Because we know our regular respirations are between 12 and 20 rest, but we know it's going to increase. But if they start, breathing heavy and they're getting fatigued and they're not feeling good, that you've overstressed them at that point. So a lot of it is kind of using the RPE, using some of your biometric devices to kind of slowly progress them, and then monitor and start figuring out what they can and cannot do. And so I think that that's still within the fitness professional scope of practice. But again, they should be getting, they should have gotten the clearance, like you mentioned, Wendy, gotten the clearance, and then you're moving from there. So hopefully that answered your question.
Yeah. So actually, as a follow-up to that, Scott, and today on Random Fit, Dr. Scott Cheatham is joining Ken Miller and I on Random Fit, talking about fitness after COVID. And Scott, you gave us some good information, but to kind of dive in even a little bit deeper, when would you say for those that are not savvy? So again, we know that some of our audience are our weekend warriors and just fitness enthusiasts. So RPE is the rate of perceived exertion. So from 1 to 10, how do you feel? So if someone's doing this on their own and they're not working with a trainer and they start to feel at this number, then you would say maybe level down a little bit or take a rest. And then if they are thinking about, investing in some kind of pulsometer or something along those lines, can you tell us when would be the shut it down? You really need to, think about this because you want your oxygen level to be, obviously 100%, but when is it kind of red line, like you need to take a break?
Okay, great question. So, so the rate of perceived exertion, as we know, it was originally called the Borg scale, and it's really a subjective, which is the person's measure of how much they're exerting through exercise. And it can be used with aerobic activity or anaerobic activity, so weightlifting. It can be used for a lot of things. We try to, when we're first beginning exercise with a client who's had long COVID, we usually like to use a cutoff of 4. So that means if they go 4 or above, they're going to take a break, and we're going to slowly kind of modulate their activity from there. That's what I've been used to. And then even with my young athletes who have had it, I try to keep it, generally around a 4, maybe below a 5. And that's more of like a moderate level activity, because we want to use the overload theory a little bit, and we want them to adapt, and we want the benefits of exercise, as we know, to help. But their whole system, which is their whole body, may not be used to that load yet, because it's still recovering from fighting the virus. So we have to remember that there's going to be a balance between the exercise. So sometimes I may start off with, maybe 30 minutes of rolling and stretching. So I might do the correct exercise continuum first, and then begin with maybe 30 minutes of exercise. And then I'm using the RPE with the cutoff of 4 or 5. And then at the same time, in between, let's say their sets, I might just put this on their index finger to measure. And clinically, the acceptable values for the oxygen level is that you want 95% or higher. That means that the oxygen molecules are getting into the lungs. They're being diffused by the alveoli, right? And so you have that good respiration and that good diffusion. So the respiratory system's working. And so that's what we're really looking for, is that 95% or higher. And so if a client or even the fitness professionals who are listening to this podcast, if you're exercising yourself and we notice that the numbers start dropping below 95, well, people start feeling a little lightheaded because they're not getting oxygen to their brain. They start feeling a lot of fatigue. So if you have a client and you start noticing that the numbers are dropping and they're feeling maybe some chest tightness, they're not feeling very good, then you should probably stop the exercise and then contact the medical professional and say, hey, look, I was just monitoring, because remember, we're not diagnosing, you're just monitoring simply, these standard numbers that are out there. And again, these have been around since the beginning of COVID. We've always used these. So I think the fitness professional can safely call the medical professional and say, hey, as we did low level exercise at a RPE of 4, I noticed that they're 92 or 93 and they weren't feeling good. So that could be one example of that.
Awesome.
So Dr. Scott, if we're talking about best practices, then, I mean, as we're treading on new and sometimes unfamiliar situations like what you're talking about with the cognitive as well as the circulatory and the cardiorespiratory situations, would you say then that would be a safe investment if we're looking at best practices as a fitness professional and you don't know what you're going to come across when, whether you're getting a new client post COVID, or if you have an existing client that, say, contracted COVID and then now they're on their way back? Would that be just, I mean, as you said, it's not a very big investment, relatively speaking, but would that be something that you would incorporate, just like you'd have your tape measure, you have your 2x4 and you have your assessment process, but pulse oximeter would be something to have in your top desk drawer.
And that's what I did, right? I pulled it up. Yeah. My kid comes home, my high school kid. You guys get it. Yeah. Check him out. Yeah, make sure he's okay. But anyways, yeah, I think it's great to have. Also too, a lot of our clients have these new biometric devices, right? These smart watches that are smarter than we are, right? And they have all these devices. So if they can monitor heart rate, but the good thing about the pulse oximeter is even years ago, I did some validation studies on these devices. They're pretty darn accurate. And as far as I'm concerned, it's a lot easier to monitor your client with this versus trying to, take the radial pulse on them and do it manually, which is a skill we should all have. But I think it's a great investment because you're not diagnosing with it. You're just monitoring standardized numbers. And it makes sense that, as we exercise, as our respiratory rate and our heart rate increases and the RPE increases, we know that they all linearly, go up as we exercise. So we should see a nice increase. And so with the pulse oximeter, you can test them within a couple seconds real time, and it's pretty darn accurate. So I think it's a great investment for any professional to have. And also it's good just to monitor your clients every so often, especially if you're taking them to the next OPT level. And for example, if they're moving from level 1 to level 2, well, we've moved from stabilization, slower tempos, all of a sudden to supersets. that's a huge jump for some of our clients. So even with a healthy client, monitoring them with the pulse oximeter, especially if they're feeling very tired, they're labored, it's just a great way of you documenting and making sure that they're staying within those preset zones that you did during the assessment. And so that's something just to kind of consider.
And you know, for those that are joining us on Random Fit today with myself, Wendy Batts, and Ken Miller, we're talking with Dr. Scott Cheatham, who has a plethora of things going on in the world. But one of the things about you, Scott, that I love is that you are a researcher. You read the research. You always you know, fill us with a bunch of knowledge. And I guess one of my last questions that I personally have for you is, like, based on the research that you're reading, what are the effects that the exercise can have with people that have had COVID or are the long haulers?
Yeah, this is an area that's been interesting, because there's actually a couple things that I want to kind of bring up, but I won't be too spicy and dicey for Random Fit here. But believe it or
you can
not,
bring it on, Scott.
Okay. All right. Well, honestly, let's talk about the fitness elephant in the room where gyms were closed down. Does everyone remember that? I'm sure Ken and I were both affected.
Oh yeah. Oh yeah.
In your practice. Well, to believe it or not, when you scour the research from the onset of early 2020, when they shut down the world, till now, there hasn't been any really big super spreader event that has occurred in a gym. It's very interesting, right? So on that note, a lot of people went to their home-based exercises. Like you can see, I'm one of the people behind you. You can see behind me, Saka. I got my at-home bike, right? So everyone, I know, right? You know, they love me. They're like, thanks, Scott. You know, so we all got stuck at home and becoming more sedentary. And so what had happened was once the gym shut down and everyone was kind of feeling, this shell shock with this new pandemic and stuff, a lot of people stayed active and a lot of people didn't. And so when we're looking at towards, 2020 into 2021, there's been several large sample studies, cross-sectional studies that looked at like 40,000 or more individuals. And they looked at the correlation between exercise and COVID-19 complications. So we can see that there's those two. So one notable study, the author is Salas et al. It actually came out of Kaiser Permanente here in California. It was interesting that it was published in late 21, and they looked at over 48,000 individuals within their database from 2020 through 2021. And as we all know too, that's when a lot of the COVID transmission was spreading across the United States, and we were really shut down. So they found that among the 48,000 cross-sectional and all the data. Now, if anyone knows of Kaiser Permanente, they're an HMO, but they do a ton of data collection. I've done some research with them, and they're, in my humble opinion, from a researcher, their databases are very well evidence-based and they document a lot. So this study came out in the British Journal of Sports Medicine. And what they said is that individuals who were more active and they did the minimum 150 minutes per week had less long-term symptoms than people who were more sedentary. And so I think right there, we started seeing the first wave of these big cross-sectional studies coming out and saying, hey, look, people who exercised may have developed some type of better resistance to these long-term complications. And so looking at that from a personal standpoint, and and also I think you all mentioned that I have my clinical practice where I do physical therapy and strength and conditioning and sports training. Well, when I looked at that study by Salas, I'm like, oh my gosh, it makes sense, because exercise had possibly some type of resistance. But then why do several of my patients over and over again who've had long COVID, if they do cardio, they feel better. So it's an interesting thing that we don't know about yet. I don't know. I mean, I'm still learning it, but we always go back to those tenets of physical fitness and what we are always promoting through NASM, right? We're trying to keep people moving. So SALIS was one of the big studies that came out. And so that spread like COVID across the world, showing everybody that exercise was important. Well, during that time, there were several other studies that came out. Some of the notable ones was a study out of Korea, where South Korea, where Lee et al. Looked at another large sample size of 76,000 Korean adults, and they found the same thing. The adults that exercised, they kind of used the general guidelines of the 150 minutes, your basic guidelines, but those in general, those who are more active had less long-term symptoms. And they also suggested within their discussion that there was a subgroup who possibly, we got to be careful, had some immunity. Really interesting. It was really interesting study when you look at it from a nerdy perspective, because we've always thought for years that when you exercise, and remember how we always talk about sweating it out and getting the immune system and stuff. These are some cross-sectional studies that are at least suggesting, hey, look, if you exercise, you might be more durable from these viruses, and possibly there might be a subgroup that has some immunity properties. I'm not sure. So it was really interesting. And then we also saw a smaller sample out of Brazil, de Souza in 21. They did the same thing. So we have basically 3 continents. And so the Brazilian study basically confirmed the same thing, that if people were active and they used the 150 minutes a week cutoff, again, they had reductions like in 30 and 40% compared to people who were sedentary. So I think it's interesting, because I think a lot of the fitness professionals who read these studies were like, we told you so, and why did you close us down? So I think it's interesting for the fitness professional, who we've always kind of empirically known that exercise has so many benefits for the body. And then we're screaming saying, hey, wait a second, why are you closing us down when people are, where there's, because a lot of the gyms, as they spent thousands of dollars on equipment, right? Clean air, open doors, so I think that there's a lot to it when it comes to what IRSA's done and all these companies to say, hey, wait a second, we understand that, that being in a closed environment obviously is going to be a risk if there's a bunch of people breathing or coughing. So we get that, but, the correlation between exercise and less complications and a small sample of possible immunity, to me, that's exciting. To me, that's saying, okay, exercise is good. And then in my clinical practice, which is very weak, this is totally not non-scientific, my patients feel better when they exercise more. Yeah, so I have no idea. It's just, so with my patients, I got to practice within my scope, but I need to do whatever I can to get them to feel better. And it's even non-scientific. I'm like, you know what? Exercise as much as you can, because it makes them feel better.
Well, Scott, to piggyback off of that too, and just, what I found interesting, I mean, obviously with the exercise and, the research that's done on COVID and mental health, I mean, obviously, we've seen, unfortunately, more cases of depression and other issues because people were not able to interact and get out and do the things that mentally made them feel good about themselves. But it's interesting that you say that, because being in Georgia, we were the first state to open the doors. And I was very, very fortunate, because where I worked, we really didn't shut down, or we didn't shut down for a long period of time. I think we were closed for about a month. And, looking at our membership, and we were actually just talking about this recently, something to think about, and the importance of all this was we were still getting together. We were still opening the gyms. I mean, granted, we wiped everything down. It was constantly being sanitized. We did follow a lot of protocols. But a majority of our members, if not almost all of our members, if they did get COVID or something, they were back at it, and they are not long haulers, but we also kept them moving throughout the pandemic.
See, and that's great. And I'm the same way. I don't know about you, but I clean my hands so much, I don't think I have fingerprints in it.
I know.
Right? Like we bleached them, and then they told us that don't worry about the surfaces, and we're like, no, yeah.
Yeah.
So no, and I stayed open. And it was interesting because I think at least in California, things crashed like in mid-March. So I was at the university like on a Friday, and then Monday the world shut down, but I still had to see post-surgical patients at the time. So, here I am walking with like an N95, and I'm basically telling the patient, hey, if I turn into a zombie, right, can you call my wife or whatever, and we're, because we didn't know, right? We didn't know. We thought everything was going to end. So you're right. I mean, a lot of the research is suggesting that 20% or more of individuals who do get COVID or the long haul symptoms, they have a lot of psychosocial issues. So I think mental health is a huge thing. And you're right. Here we go from a very active society where we're interacting with people. We're such a very mobile society to isolation and immobility. That's going to cause a decline in function all the way through, including our psyche and our emotional state. So I totally agree with that.
So Scott, we talked about those that exercise, they got better. They had better resistance. And like you're saying, there's evidence of some immunity properties. But what about that person that they weren't an exerciser? And again, those studies that you mentioned from Brazil, South Korea, the US, if somebody was not getting those 150 minutes, and how do we progress them? And I know you talked about the OPT model. For those that are not familiar with the National Academy of Sports Medicine and their training model, which is the optimum performance training model, you've brought it up a couple of times. How do you grade somebody, or how do you get somebody to go through that model if they haven't been an exerciser and they are post-COVID, and they want to have they want to be able to tolerate it should that experience happen to them again?
Yeah, great question. So I think the first thing that I always do within my practices is part of the screening process, or if I'm working with a healthcare provider, I need to make sure that the client does not have or has existing comorbid conditions like hypertension, diabetes, heart disease, and I think hopefully, I think everybody who's listening to this podcast is pretty familiar with, a lot of the comorbid conditions that can that can actually magnify the complications of COVID-19. So some of the main comorbid conditions, if we want to review, would be hypertension, diabetes, someone who's had a stroke, current cancer, obesity, kidney or liver disease, sickle cell disease, chronic lung disease, and then heart disease. So those are the main comorbid conditions that they've seen that individuals who do have it seem to have greater complications from COVID-19 because their immune system is already supposedly compromised with these comorbid conditions. So I recommend the first step is, if you do get a client who, let's say a new client, or they're working with somebody who's had COVID-19 and they have identifiable comorbidities, you got to go back to the healthcare provider and you need to work with them on that, especially things with like diabetes and hypertension, and also some of the obesities. And we're talking like a BMI 30 or over, okay, sometimes even 25. So we're looking at these kind of these comorbid risk factors that the person can definitely have stronger complications. So again, some of that is still unknown, Ken, where we take somebody who might be more sedentary or whatever, but those people have to have a slower start than somebody who's been working out and someone who's clear, you clear them medically of these comorbid conditions. So I mentioned before the optimum performance training model. And I like that because phase one is pretty straightforward. You work on a lot of stability, proprioception. You're starting to rebuild that muscular endurance because, as I mentioned before, in my opinion, COVID-19 is a systemic disease, or a systemic virus. And the issue is that a lot of times people who are convalescing after the virus and they have those long COVID symptoms, they may not be that active. So all the physiological systems of their body kind of become deconditioned. So you have to start off somewhere that's logical. And we know over the years, the OPT model is very evidence-based. It's very straightforward. And so you have to start somewhere. And that's where I use that in my practice, where I'm really trying to prepare the person and get them more fit. And for phase 2, 3, 4, and 5, as we progress them, but based on their goals. So I also think too that every healthcare and fitness professional should do a very comprehensive assessment, from the intake and interview to the screening, all the way through your movement tests, your strength tests, and your performance tests. So I think it's very important for everyone to do a complete, because you have to get a complete picture of these clients and not assume anything. You can't just say, "Oh, how are you feeling?" Because I've had some clients who want to push themselves because they're tired of feeling kind of like crap, and I've had their oxygen levels drop in the middle of our phase 2 supersets. It's pretty obvious, and we've had to sit down and rest, and I've had to monitor them. So you never know with this virus, if in the middle of exercise, they're just going to kind of bonk, right? They're just going to bonk and just kind of get super fatigued. So we can't assume that. So if you start off at a reasonable level 1 and your cardiorespiratory is kind of like a zone 1, yeah, do it for a couple weeks. Just kind of prepare them, get them comfortable with working out again. Because remember, in my opinion, sometimes with some individuals, 80% of it's up here, 20% of it's physical, right? So a lot of these individuals that we have to remember, and I want to kind of do a public service announcement on this one, a PSA, is that they're going to be scared. They had COVID. These long haul symptoms really kind of mess them up a little bit up here. They're afraid. They don't know why they can't remember things. They don't know why they cannot focus. I have college kids who dropped out of school for the semester because they can't focus and they can't study. So again, these symptoms manifest themselves, but we cannot take it for granted, because fitness professionals are healthcare professionals. And so it's along the continuum. So all those fit pros out there, I think you got to dig a little bit deeper in that initial assessment, and don't be afraid to ask somebody who's had COVID-19, how are you feeling? Right? Because that's sometimes the best is, how are you feeling? Do you feel comfortable with working out? And during the workout, while you're getting the RPE, why not stop and check with them? How are you feeling right now? Are you feeling okay? Do you feel good? So then if you're doing those kind of those checks, they're going to build the confidence. So you're going to have to build confidence, and you're going to have to get them comfortable. So that's where in my opinion, the phase 1 simple, let's get it going for a few weeks, get them comfortable, comes into play. But as you're presenting your assessment findings, and as you're going over their SMART goals, as you're completing their first session, you should, in my humble opinion, be very clear with your communication and effective, and say, hey, look, I want to spend the next 2 weeks getting you used to exercise. I want you to build your confidence and feel comfortable. So we're just going to take it slow.
Yep.
Then build up from there. But you need to communicate effectively that first session. I think it's huge.
Yeah, no, that's gigantic with any client, but again, especially with those that are post-COVID, trying to get back into fitness, and for all the benefits that you mentioned. Mm-hmm. But I'll say this, guy, hey, I learned a ton. I mean, you confirmed some things, but you also enlightened quite a bit, especially when it comes to the systemic approach to somebody coming back post-COVID. It's not just a physical, but there is a mental, cognitive standpoint to it. But hey, Scott, always great working with you, seeing you and listen to you speak your words of wisdom when it comes to anything that we've had a chance to work together with. So thanks for being with us today on Random Fit, Scott.
All right. Thank you, everybody. Thanks, everybody. Have a great one.
All right. So on behalf of Wendy Batts and I here on Random Fit, thank you so much for listening to us on this episode and talking about fitness after COVID. So if you liked what you listened to today, like, follow, subscribe, share, and please always let us know if there's anything you want us to talk about here on Random Fit. So until next time, take care and be well.